So when talking about detox, I think one thing to understand is every patient is an individual, and they come seeking detox with their own individual needs and background and history. But the one common factor of all patients is if you use opiates, you become opiate dependent, and if you stop opiates, you have a withdrawal syndrome, right? So that's the one commonality. So how do we treat that? You can go unaided, and there's unaided detoxes that can last days, weeks, or months and experience the full experience. And then there's a lot of other detox options out there. The one that I'm a proponent of and have specialized in for over 25 years now is rapid opiate detox or ultra rapid opiate detox, because I feel that there's certain things that are basically essential. You want to be able to detox somebody safely, effectively. And once you've detoxed them, then you can address all the other issues that surround addiction and all the other aspects. But the first step is detox. So I feel that to safely and effectively detox somebody, you have to have a full understanding of their underlying medical issues. So that involves an assessment, history, physical, blood work. And once you have an understanding of what their underlying medical issues are, you have to understand what substances they're using or abusing and how that affects their physiology. And so I think it's for safe and effective. To me, it means doing this in a hospital-based setting where the patients come in, and on day one, we do a complete history and physical, and we do chest x-rays and EKGs and blood work to fully understand what their underlying medical issues are. And then we can hydrate, and we can pre-medicate, and we can replace electrolytes and monitor blood pressure and blood sugars. So they're optimized before undergoing a detox. And then for what I do, we do rapid detox, right? So that's done in a very closely monitored ICU setting. I can give them sedation so they don't remember or feel anything. I've already pre-medicated to block the part of the nervous system that causes withdrawal. And then I can give them a medication to accelerate or precipitate the withdrawal while they're asleep, and then closely monitor them in the ICU setting for 24 hours, and then to get them over to an aftercare setting that's very supportive, where we can monitor and begin to address the other issues while their body transitions to its new normal. So for me, the safe, effective involves all of those things: the pre-assessment, the pre-medication, the actual procedure itself, and then the supportive environment afterwards, so we can support them and help them transition to an opiate-free state and begin to address any underlying issues that have brought them to where they are today. So I think that in a nutshell, those are the components of a safe, effective, rapid detox.
Yeah. I have Claire, I'd be interested to hear your perspective on this as well, as being the founder and having been in this business for so long, in the way that you set up the clinic and the treatment specialization. How have you seen that evolve with the world of rapid detox, and how do you see that industry and that treatment? What should people know about it?
I think it's medicine, and medicine is as good as the physician that is practicing it. The responsibility, the experience of the physician makes all the difference. So I think the word rapid have to be used very responsibly, because how rapid you can do something, or you can treat somebody that has been taking a drug for 10 years, 20 years. There's a limit for how rapid that should be. There's a responsibility for the patient. I think when Dr. Lowenstein talked about admitting the patient the day before procedure, it is so important. So many times we have found, Dr. Lowenstein and his team has found things the patient was not even aware that was going on. There's also what patients are ingesting 24 hours before the procedure. Especially with illicit drugs, there is so many different chemicals that could be in there. And if you admit the patient the day of procedure, you don't know what you're dealing with. You don't know the combination of the drugs that we give them and what they've taken, what the effects of that can be. So again, responsible medicine is incredibly important. And again, you're dealing with human beings, so you can't just, uncover that blanket that numbed them physically and emotionally for so long, send them to a hotel room with a family member and hope for the best. Everybody's full of anxiety. Everybody's full of fear. The patient is fragile. The patient is, not emotionally stable. There is, and Dr. Lowenstein can talk more about that. There's hormonal imbalance. There is chemical imbalance. There's so many things going on that the job cannot be done with pure rapid detoxification. So you can't put a patient on the day of detoxing and send them to a hotel room. For me, that should be illegal.